The Histology of Connective Tissue by Jonah Stern and Taylor Roasa. Histology is the study of the microscopic structure of cells, tissues, and organs in relation to their functions. Connective tissue is one of the 4 types of tissues that can be found in the human body. Connective tissue makes up part of every organ in the body and is usually connected to epithelial tissue via the basal membrane. Epithelial tissue being tissue that covers surfaces outside and inside the body. In this video, we will be discussing the histology of connective tissue, its structures, functions, its location in the body, and possible diseases or disorders that can be contracted in one's connective tissue. The 3 types of non-living fibers that make up connective tissue are collagen fibers, elastin fibers, and reticular fibers. Collagen fibers are the most abundant of the 3 fibers. It is a protein that is strong but mildly flexible. Examples of collagen fibers being used in the body are in bone, cartilage, tendons, and ligaments. Elastin fibers give strength and high amounts of flexibility. Some examples of elastin fibers being used in the body are in blood vessels, lungs, and the skin. Reticular fibers contain both collagen and glycoprotein to give support and strength. Some examples of reticular fibers being used in the body are in the basement membrane and the organ stroma. The cells that make up connective tissue consist of fibroblasts, macrophages, lymphocytes, adipocytes, chondrocytes, osteoblasts, erythrocytes, leukocytes, osteocytes, reticular cells, and mast cells. The 3 common endings of the names of cells consist of class, which means to break down, blast, which means to build up, and cytes, which mean to maintain. The miscellaneous structures that make up connective tissue consist of the matrix, lacunae, lipids, lamellae, plasma and blood, yellow bone marrow, and red bone marrow. The matrix is the ground substance for connective tissue. It is made of non-living material, usually the 3 fibers previously mentioned. It supports living cells and is amorphous, meaning it can be in a solid or in a liquid state. There are 14 types of connective tissue that we will be discussing. Areolar connective tissue is soft, pliable, and has the ability to soak up excess fluid. It contains elastin, reticular, and collagen fibers. It also contains fibroblast cells, macrophages, plasma cells, adipocytes, and mast cells. It is found in the subcutaneous layer of the skin, blood vessels, and the mucous membrane. Adipose tissue functions as a thermal insulator, an energy storage unit, and to support and protect organs against injury. It consists of adipocytes, which contain large amounts of lipids. Adipose tissue is located in the subcutaneous skin layer, yellow bone marrow, pericardium, and renal fascia. Dense, regular, collagenous connective tissue is strong and resistant to stretching. It contains a matrix of collagen fibers and fibroblast cells. Dense, regular, collagenous tissue is located in tendons and ligaments. Dense, regular, elastic connective tissue is capable of stretching and recoiling with strength in the direction of fiber orientation. It contains a matrix of regularly arranged elastin and collagen fibers and is located in ligaments between the vertebrae along the dorsal aspect of the neck and in the vocal cords. Dense, irregular, collagenous connective tissue is strong and capable of withstanding stretching in all directions. It contains a matrix of collagen fibers that run in all directions and few fibroblasts. It is located in the dermis of the skin and sheaths, organ capsules and septa, and the outer covering of body tubes. Melanoma is a skin cancer caused by the overabundance of melanocytes in the skin. Melanocytes can be seen in this sample of dense, irregular, collagenous connective tissue. This sample has melanoma. If melanoma is contracted, a mole will form in the affected area. This mole will be irregular in size, color, border, and will be itchy. Melanoma is caused by DNA damage resulting from increased amounts of exposure to ultraviolet light, or UV rays. This light is most common from the sun, but is also found in tanning beds. Dense, irregular, elastic connective tissue is strong and capable of stretching and recoil in several directions. Its matrix is composed of bundles of collagen and elastin fibers oriented in multiple directions. It is located in the elastic arteries. Reticular tissue provides a superstructure for the lymphatic and hematopoietic tissues. It contains a network of reticular fibers irregularly arranged in lymphocytes. It is located within the lymph nodes, spleen, and also in the bone marrow. Hyaline cartilage provides rigidity with some flexibility and forms smooth, rugged, yet somewhat flexible articulating surfaces. It contains a seemingly clear matrix made out of small collagen fibers with chondrocytes found in lacunae. It is located in growing long bones, cartilage rings of the respiratory system, costal cartilage of ribs, nasal cartilage, articulating surfaces of bones, and also in the embryonic skeleton. Fibrocartilage is somewhat flexible and capable of withstanding pressure and connects structures subjected to great pressure. It contains bundles of collagen fibers with chondrocytes and lacunae. It is located in intervertebral discs, symphysis pubis, and also in articular discs. Elastic cartilage is similar to hyaline cartilage, but it provides rigidity with more flexibility because it contains elastin fibers that return to their original shapes after it's been stretched out. It contains lots of lacunae, chondrocytes, and threads of elastin fibers that are dispersed randomly throughout its matrix. It is located in the epiglottis, external ear, and also in the auditory tubes. Cancellous bone acts as a scaffolding surface to provide strength and support with low weight. It contains a network of scaffolding characterized by trabeculae with large spaces between them filled with hematopoietic tissue, osteocytes in the lacunae, and osteoblasts. It is located in the anterior bones of the skull, vertebrae, sternum, pelvis, and also in the ends of long bones. Compact bone provides strength and support that forms an outer shell on bones that protects from breaks. It contains many osteocytes located in the lacunae and a surrounding matrix organized into lamellae, surrounding a central canal, ultimately forming an osteon. It is located in the outer portions of all bones and in the shafts of long bones. Blood tissue has a fluid matrix that contains water, salts, and gases, called plasma. The cells inside the tissue include leukocytes, white blood cells, erythrocytes, red blood cells, and thrombocytes, platelets to help clotting. It is located within the blood and helps blood clotting, immunity, and the transport nutrients, gases, and wastes. Leukemia is a group of cancers of the blood. Usually beginning in the bone marrow, leukemia causes an overabundance of white blood cells which are not fully developed, called leukemia cells. This blood sample contains more white blood cells, or leukemia cells in this case, than a normal sample should contain. Symptoms of this type of cancer generally consist of bleeding and bruising problems, fatigue, fever, and ultimately cause an increased risk of infection for anybody who has it. Systemic lupus erythematosus, or SLE, is a disease that can cause inflammation of the connective tissue of every internal organ in the body, including but not limited to the heart, lungs, liver, and kidneys, while also possibly affecting the joints, skin, and nervous system. As can be seen in this sample, the presence of autoantibodies is a main characteristic of SLE. The body produces antibodies that help protect against pathogens like bacteria and viruses. However, autoantibodies attack these antibodies, and if one has SLE, his or her immune system will end up attacking healthy tissue, causing the inflammation previously stated. Bone marrow produces new blood cells and stores lipids. It contains a reticular framework with blood-forming cells, red marrow, premature red blood cells, and lipids, yellow marrow, located within the cavities of bone, yellow marrow in the shafts of long bones, and red marrow in the ends of long bones and in short, flat, and irregularly shaped bones.